Well, good morning, everybody. I will turn on, this is Amanda Bergamo, and I am with New Mexico HIMSS chapter. I am the advocacy chair for New Mexico HIMSS, as well as Western Region Vice Chair of Western Region of the United States and Canada. Happy to have everyone here today. Very glad to have had such a nice week promoting our first ever Global Health Equity Week. We had a few great guests this week. They were blogging and we were posting on our social media. So if you get a chance, check out our LinkedIn site or Twitter site, New Mexico Hymns. To kick off the week, we had Tom East as part of Synchronous, which used to be the New Mexico Health Information Exchange. And they were providing some updates on what they're targeting for upcoming 2021 and also some activities that they've been involved with this past year to ensure that data is passed back and forth between all of the healthcare providers in the state of New Mexico to improve equitable healthcare and that it's made available to all New Mexicans. They had a great relationship. They brought in I think Tricor was one of their partners this summer to ensure that they were also getting lab results. Another organization that participated this week was Presbyterian Health Care Services, and we had the Vice President of Community Health, Lee Caswell, blog about the work that they're doing in regard to social determinants of health and the platform that they're now going to be using called NowPal. And that is going to be collecting this type of information to be able to give back to clinicians as they're at the point of care with patients and it supports the referral system to provide patients with gaps in healthcare and to help them get the resources that they need. And our other partner that we highlighted yesterday was New Mexico First. And we have Lily Irvin Vitella here on the panel today or available for the Q&A discussion. And I believe Tom East also will be here from Synchronous. But New Mexico First is working on also providing information to address policy and support public policy changes around prioritizing healthcare gaps across the state of New Mexico. They did provide us with a link to the survey that they had sent out in 2019, along with and Lily can confirm this, about 25 plus town halls across the state of New Mexico to capture information from the voices of our community in New Mexico and take that back to improve our policies and take it back to our legislators. So we were so happy to have all of these great guests this week. And we're wrapping it up with a wonderful event today. So thank you for joining us, everyone. And with Gabe Mounts and Jason Jarvis, and Beth is going to introduce them and tell you a little bit more about the work that they've been doing and the work that they're going to showcase today. So thank you for joining us all. Beth?
Thanks, Amanda. Good morning, everybody. I'm Beth Barrett. I am a member of the HIMSS board here in New Mexico. And we thought it would be really great to share with you this initiative that the HIMSS organization here has been involved with this year from several different perspectives, with Gabe Mounts from the Air Force Research Lab, as well as Jason Jarvis from Senator Heinrich's office. What we're going to do today is I'll do a quick introduction about Gabe and Jason. They're going to share a presentation with us about this New Mexico COVID-19 emergency supply collaboration, which has been an initiative to try to help fill some of the gaps with PPE and other pandemic-related supplies here in New Mexico. We're going to probably do that for about 20-25 minutes, and then we're going to spend some time at the end sharing some stories about some of our experiences. Myself, Amanda, and Stephanie, who are all on this call today, have all been involved with this pretty closely over the course of the year. And we'll share some stories from all of our perspectives. And then we'll wrap up with a Q&A. So you can ask any questions, and look forward to your participation today. I'd like to start and introduce our speakers, beginning with Gabe. Gabe is the director of the Space Force Accelerator Technology Commercialization Lead for the Air Force Research Lab. He directs the program and oversees the Hyperspace Challenge in Albuquerque and the Catalyst Space Accelerator in Colorado Springs that focuses on connecting entrepreneurial startup community to the US Space Force. He's also the technology commercialization lead for ARFL, where he oversees all the aspects of technology transfer, community engagement, and marketing and publicity for directed energy and space vehicle technology. Gabe has recently been the founder of this initiative for New Mexico COVID 19, and which has brought together entities from government, nonprofit, and the private sector to support the pandemic. Also with us today is Jason Jarvis from US Senator Martin Heinrich's office. Jason is a field representative for the US for his office and manages a broad field of portfolio that spans energy, economic development, healthcare, higher education, space, science, technology, military, and veterans affairs. Jason serves as a local liaison between Senator Heinrich and Senator's statewide constituency and has been a key member of this initiative with COVID-19 emergency supply. With that, I'm going to hand it over to Gabe and Jason, and thank you for being here today.
Hey, thanks, Beth. So good morning, everyone. Thanks, Amanda. Appreciate the opportunity to come on here and speak about the collaborative and what we've been doing in response to the pandemic, and kind of couch it in the terms of health equity and what we're seeing across the state with health and with what's happening because of the pandemic, and just try to draw a few of the themes for you. Quite frankly, this whole presentation really is a set of stories. And so we'll get right into it. So let me share my slides here. If you don't mind, Stephanie, would you let the other Gabe on the line here? If you see my my other intro, are you able to let me share slides on that side?
It looks like you're logged in as a panelist, that one as well, so you should be able to.
I am
Oh,
not
wait.
able
Oh,
to
here we
do
go.
it.
I got it. Sorry about that. Try
No
that now.
problem. Here we go. Thank you. All right. So the collaborative at the, at the simplest form is really, as you heard, a collaboration, a confederation, if you will, of multiple players that came together to address the pandemic, in particular, the shortage of personal protective equipment that happened right as soon as things got really bad with the spread of COVID-19. So I think it's probably well known, especially I think to the audience here, that when things started getting pretty, when we started seeing spikes across the country at the beginning of the year, a lot of hospitals, a lot of healthcare providers became inundated with cases. And because of how virulent this virus is and how much it spreads, a lot of effort went into providing for themselves, healthcare providers providing for themselves to protect themselves by utilizing equipment, mainly masks, face shields, isolation gowns, gloves, all the things you might need to keep yourself safe when you're working with a virus like this. So because of the huge spike, the worldwide shortage of that supply, there was a worldwide shortage of that supply, and demand was just highly exceeding what the manufacturing base across the globe was able to produce. So at the root, this collaborative was stood up to help our local New Mexico healthcare providers find a way to access that PPE in order to continue their operations and address the needs as the cases came in. So that's the gist of the collaborative. I'll go into a little bit later exactly how we do that as a collaborative, as a confederation of players to enable healthcare providers to access this supply, some kind of supply of PPE. But I wanted to start with just a story as to, why is somebody from the Air Force even involved in this in the first place? And why did we stand this up? Like, how did this get going? So um, uh, let me go a couple of slides down. The collaborative, as you see, this is just a snapshot of some of the organizations that are currently involved. And unfortunately, I haven't captured nearly all of the other players. There's quite a few more that I just don't have logos on here. And of course, you'll see names on here of companies of the folks represented right now in this webinar. So you have Amanda here representing Unity BPO. We have the HIMSS group, more or less, in my mind, represented by Beth Barrett. We had some other folks in here that came in a little bit later, but that have helped us more or less through the HIMSS avenue, namely Stephanie Garadia. So thanks, Stephanie, for running tech today, but she's also been helpful with her company, Versatile Med, and kind of doing some data analytics for us and helping us set up some processes to enable us to do the work. So I just wanted to quickly shout out and thanks to you guys and thanks to everybody on, that's been helping us with this collaborative. The story here is this. The reason I started this is that I got a call back on March 24th, kind of out of the blue, from a friend of mine at Loveless, who happened to be the CEO of Loveless, asking for help in finding a piece of equipment to help them do some testing for PPE. They were anticipating a shortage. Loveless was anticipating a shortage of PPE and was trying to figure out how in the heck could they get some of this, especially in their case, these N95 masks that were the high quality masks that are able to apparently filter out the virus. Those were in very high demand and were incredibly short supply. So in anticipation of the shortage, the folks at Loveless were working with some local vendors, some local manufacturers to create some masks that were of the same quality as what they might find normally within the normal supply chain. And a few vendors were working on these locally made face masks, and what they then needed once the prototype started going into production was, how do we test to make sure that these things are filtering particles at the level that these bona fide N95 masks were filtering at. And so he called me. He knew I worked at the Air Force Research Lab. Of course, you heard from Beth in my intro that part of my job is community relations. And so he asked for help to see if we could not track down a piece of test equipment that they needed to do this filtering test. So I immediately went to work and reached out to all the contacts that I had across our tech sector here in Albuquerque, which included my counterparts at Sandia, and our counterpart at the New Mexico Manufacturing Extension Program, Jennifer Sensaval, to find out, hey, is there somebody in the state who has this piece of equipment? So long story short there is they eventually did find the capability to do this testing. They did it at Sandia. That story worked out pretty well for them. But the side effect, a side effect that I personally was not expecting, was that I all of a sudden became sort of this person that was at the nexus, the epicenter of a bunch of information crossflow on what was happening with COVID. So I started getting inundated with inquiries about how can I find equipment? How can I find personal protective equipment in particular? While at the same time getting a lot of phone calls and a lot of emails, just a lot of contacts from people trying to figure out how they might could plug in to help in this particular situation, all based on sort of that initial set of emails and communications that I started. So right around March 24th to the 27th, because of the inquiries and the connections I was making to Sandia, to UNM, the governor's office called almost immediately, folks at CNM, and there were, another part of the story is there were folks also right about the same time, because they were seeing what was happening in the media and the news worldwide, they started just doing stuff on their own. So CNM Fuse, for instance, and our own guys at New Mexico Tech, I'm sorry, I say our own guys, the Air Force Research Lab has a great partnership with New Mexico Tech, and some of New Mexico Tech's staff actually work to help support what I do in the Air Force Research Lab. So a lot of entities were starting their own processes and their own activities to actually provide equipment that might could be used for this need. So a lot of that was happening, and I was getting a lot of connections and contacts about that. A lot of information offering for help. So like I said, I started getting inundated, and I thought there has got to be a better way to address this need. I can't be one of the only people managing the information crossflow. So I turned to my colleague, and his picture here, he's on the call. So, hey, Matt, I hope you don't mind me using your picture. So Matt is the New Mexico Tech. He's our director for the New Mexico Tech side of our operation at the Air Force Research Lab. I work very closely with him on a daily basis anyway. And I just said, hey, is there a better way to manage this information crossflow? And then I told him, I noticed that there were other states doing a lot of other different things. And, maybe we can model something off of that. In fact, in particular, I had seen a site set up by seemingly a confederation of, concerned citizens in New York City that had a really great website that basically allowed kind of 4 types of things to happen. If you were a healthcare provider in need, you could identify yourself. If you were somebody who had supply to sale, you could identify yourself. If you were a concerned citizen and just wanted to pitch in to help, you could identify yourself. So we decided to go ahead and launch our own website, modeled off of that New York City website, in order to kind of help manage the information and at least give an opportunity to our state to allow people to, make requests or identify opportunities, and then go from there. So we launched the site approximately March 30th. We started holding daily meetings with the initial members that I had already made contact with that I just previously named. Around March 31st, about that week, I got an inquiry from Jason, and soon after from some of the staff members that support Representative Deb Holland. In the next slide of the timeline here is we then started, once I started developing, or we had sort of a core group of people wanting to participate and contribute. One of the first things that I realized that Matt Gallegos, my partner here, very soon realized was that we needed to have some kind of process or some kind of activity in place to manage all the inquiries that we then started receiving through the website. So in order to do that, our initial way to manage it was to hold these not only daily meetings that we started, but now twice daily meetings to help us triage essentially the database of inquiries that we had started to receive, and then start trying to put into place some way in which we could address them. And then later, as things went on, we just started incorporating more team members as they became aware of what we were doing and as they were introduced to us. One of the particular stories that we might talk about later is, like I said, there were other entities out there that were standing up independently to do things maybe in a similar fashion. One of those entities was a collective of medical students who were seeing a little bit alarmed by what was happening in the hospital systems, and they wanted to help. So they created something called Protect New Mexico. They identified themselves to us through our website. And then one of the first things I did was when Jason was helping, when he came on board to help us do some work, we said, could you look at triaging these inquiries, which included this inquiry from Protect New Mexico. And Jason was then able to facilitate a meeting with this team of young medical students. They started, their main goal in life was to start running PPE drives, right? Public drives where they would get donations from the community. And then they would try to pipeline them to the needs in the community as well. But they didn't really have a good mechanism to find out what the needs were. And it turns out that we did because of our website. And so we kind of launched a great collaboration with them to do that. You'll see some other names there, like I mentioned earlier. In some of my initial communications, I immediately got feedback from Amanda. So there was some capability that her company, Big Byte, I'm sorry, not Big Byte, but Unity BPO had that we thought might be useful to this endeavor. We also, I think, Amanda, I think it was through your efforts that also the New Mexico Tech Council came on board, and Nerissa Weddington, who runs Big Bite, became an instrumental player as a representative of the Tech Council to help us out on the tech side. And then later you see some of the other folks there that I mentioned earlier that joined us. So let me quickly, before we get into some of the stories, let me just go into what we initially did. The website really had a few parts. Our initial, me and Matt Gallegos' initial idea was that we would just create a space, essentially, for folks to self-identify with each other and then make the connection kind of on their own accord, supply to demand, if that made sense. But what we soon realized is that we probably needed to do a little bit more active management of that supply demand activity. And the first things first was that the state was incredibly interested in making sure that the healthcare providers, especially the big hospital systems throughout the state, were aware that they could go to the state stockpile. So one of the things that we did almost immediately, and also because we were one of the first websites out of the chute to address this issue, the governor's office was very quick to say, we would just like to follow right behind your website if you can and what you guys are doing. And as you get needs that are coming in from the healthcare provider systems, could you please at least pipeline some of those to our emergency managers across the state so that we can do our best to manage supply to those guys from our state stockpile system. So we immediately started doing that. We then decided to create two kind of similar activities, but they had kind of different characteristics. The first is we did start getting a lot of feedback about suppliers who could provide equipment for sale. So what we immediately did then was to publish a directory. That was a genius move by Matt Gallegos. Just basically publish on our site, here's a directory of the suppliers we know can supply equipment for sale. Many of them were local based, and we just basically put it out there for anybody to see on the website so that they could just go themselves and kind of help themselves do that. What Amanda and Unity BPO brought to the table, and then Nerissa from Big Bite also was helping on this project, was let's put some technology in place, some applications in place that could then allow, sort of like you see in modern day point of service operations, the likes of Airbnb or the likes of any of these other modern technology companies, where we can allow the companies that have supply, and we can then allow all the people who are customers basically that have needs to utilize an app that allowed them to be more or less automatically matched to each other, where they could then undertake their own transaction to buy and in some cases maybe receive donated PPE. I mentioned earlier that we had brought in this group called Protect New Mexico. I had not originally conceived of this website or our operation as being something that we would actively manage when it came to receiving donations and then getting those donations into the hands of people who identified themselves as needing donations as opposed to perhaps for sale items. But the guys at Protect New Mexico were really already kind of going hot and heavy down that path. And so basically what they brought to the table, or what they helped instantiate in our operation, was what I kind of colloquially called a donation exchange. And of course, they weren't the only ones. We said, as I said earlier, we had the likes of CNM's Fuse Makerspace, who was making face shields. We had our own Air Force Research Lab Makerspace, who collaborates very closely with Fuse, was also making the same face shields. So they became sort of a face shield creation operation. We had the folks at New Mexico Tech down on their campus in Socorro, a young professor down there, Dr. Danielle Turner, who her and her colleagues were pumping out gallons and gallons of hand sanitizer. So they came to work with us through the collaborative to kind of get that hand sanitizer distributed. And we had a number of others. I think through Jason's effort, we brought on Dr. Christina Salas at UNM. She was in the middle of creating, or she had created an operation where she was also making 3D printed, instead of face masks, which are, or, I'm sorry, the face shields, which are the shields that kind of cover your whole face. She was making respirators. So sort of a different variation of a mask that you wear on your face to filter out, essentially to filter out the virus particles. So Jason introduced us to her, and we started working with her operation pretty closely to also manage her donations, as well as her helping us get other donations out to some of the recipients that she was already working with. Later over time, because of that donation operation, we evolved into a second phase. Partly this was also because I found out, Matt and I found out pretty quickly that the number of items that were being requested, we originally set up our website that we had a whole litany of things that people could request as far as personal protective equipment, but there were really only a handful of items that people were really asking for. And they were the N95 masks, your basic surgical masks, face shields, isolation gowns, and gloves. And so because we saw that that was the majority of things being asked for, we decided to simplify our website a bit and make it such that we were only worried about people that needed those equipment. If you came to us, you were only able to request or look through these other elements for those items. And so we kind of simplified the website to make it request for a donation, or an option if you wanted to donate PPE. We had the directory there, of course, and then we were working on this self-service application that was helping plug people together. A note about, let me see, did I skip? Oh, I'm going to go back up here. A note about the self-service application. Because the New Mexico Tech Council, when they became aware of what we were doing and we started collaborating, what we were told at the time is that they had also been looking to stand up something like what we already had in place. And so what they decided to do, it may have been a little bit more nuanced than that, but what they really wanted to focus on was how can we also address the local business needs in the community, maybe outside of the needs for PPE, other things that the business community might need. And so because we were already working with Amanda and Unity BPO on this self-service application, and because Amanda and Big Bite and Nerissa were already part of Tech Council, we decided to go ahead and utilize what we had built for the collaborative to also service what became Business Different, which is the logo that you see in the, on the chart. So Business Different is kind of the New Mexico Tech Council. The logos are there, but run by that collaborative to kind of address a broader need for the business community. But it used that same back-end application that we were using for our PPE operation. So, long story long, we are still in operation. So far, we have made a lot of donations. And again, I'm counting numbers that aren't maybe necessarily, I'm counting numbers as a wider collaborative. Many of these deliveries are made by several of our independent collaborative partners who were making a lot of supply, and then through our operation, finding the right need to address and providing out to the community. One of the things that I kept telling everybody, and I still tell everybody, is that this was, no kidding, an egalitarian collective. Each of the independent entities that were helping, and to a large extent, were doing this independently. I was not trying to necessarily, or the collaborative, we weren't trying to in any way govern their operation. We simply were trying to be, as best we could, a connecting point to enable them to continue doing the work that they were may have already been doing to great effect. And then one other side vignette as we get into the stories here is that, and by the way, thanks Stephanie for this great graphic from Versatile Med. A story that sort of goes back to when we brought in the Protect New Mexico students. We did have a list of needs that kept coming in and that we were constantly triaging based on what was needed, what we had in stock, how well we might be able to deliver to them, Our delivery operation was amped up quite significantly when Beth Barrett from HIMSS came on, representing HIMSS, and Wes Miller from the PMI group. They came on to help me really refine the delivery operation and transport operation, especially since we had not been originally planning. But as we triaged what was needed, we quickly found that, and I think this is probably well known, the Native community started getting hit pretty hard. And so in a sense, this graphic shows a lot of our deliveries for a good period of time, and even still today to some extent, we're going to those communities, and especially in the north west part of the state where the Navajo Nation was hit pretty hard. So we made a lot of effort through the collaborative partners to get equipment to the nation and to the other tribal communities across the state. With that, I guess it's time for some more stories. There's some really awesome work that was done by a number of people in this collaborative. And it's just a tremendous, incredible story of all the people who came together to work together in a very egalitarian nature quickly to try to get things into the hands of people who actually needed them. So these pictures represent many of these stories. I mentioned earlier C&M Fuse. That's the kind of news story that you see in the upper left-hand corner. We quickly started taking a lot of their stock and getting it out the door. But I'll let Jason has some good memory of some of these stories. I'll turn it over to him for maybe to kick us off with a few interesting stories that we had.
Thanks, Gabe. So when I was looking back and thinking about the earliest days of my involvement with this collaborative, I remembered a couple of things. One was when I let the senator know what Gabe was doing and the partners he brought together to try and address this critical issue, he basically told me two things: help Gabe and let me know how I can help. And so he really gave me a lot of leverage to really engage with Gabe and do whatever I could in helping him sort through information and share information, and on occasion actually help with delivery. So very appreciative to Gabe and to Matt, especially for all the hard work that they did. One of the first things that Gabe and I got involved in, he was working with, I think, the Defense Logistics Agency, and they had a collection of PPE supplies that were essentially deemed excess. And they were going to give them to Gabe with the nuance, I think, that they needed to go to a federal entity. And so Gabe was thinking maybe the VA and maybe Indian Health Services, and reached out to me to see if I had any contacts with those entities, which I did. And we had essentially brokered a potential donation. We hadn't actually had any of this product in hand, but we had committed to IHS and to the VA so many numbers of face shields and things, only to later find out that DLA had to forfeit the supplies to I believe the Department of Homeland Security under an executive order to put excess supplies into the national stockpile. So we quickly had our first attempt at donating collapse. And then Gabe ended up kind of rebounding with his friends at DLA, and they found this person at the
National Security Agency, the NSA.
Yeah. So this is an intelligence organization, and they were making face shields. So, and that particular person had a connection with New Mexico. Is that right, Gabe?
Yeah, the lady used to work at Sandia before she went out to the NSA.
So she had kind of a personal commitment to help Gabe out and get products back to New Mexico. So she started shipping these boxes of hundreds of face shields to Gabe. And we were able to circle back with IHS and the Department of Veterans Affairs and let them know, hey, we have the face shields we were going to give you. And one of our first deliveries was to the VA hospital, Raymond G. Murphy VA Medical Center here in Albuquerque. And I think Gabe and I were I think I just told Gabe, yeah, just take him over there. I gave him the point of contact, go drop him off. And he was like, okay, sweet, I'll do it. And then Senator Heinrich heard that we were going to drop these things off at the VA. And he texted me and he was like, hey, I want to go with Gabe. So very last minute, the senator got involved. He met Gabe over there and helped hand off those supplies to Director Welch and his team. And it was just a great opportunity for the senator to meet up with Gabe early in this process and see how this was going and what Gabe was doing with all the partners. So that was kind of just one of the great opportunities, I thought, very early. Another one was we ended up connecting with a tribal member at Zia Pueblo. And I called him one day just to check in and see how they were doing. And he was just really blunt. He was like, I need 300 face shields tomorrow. And at that time, I didn't know if we had 300 face shields. And I was just like, okay, well, let me see what I can do. So I called Gabe. Hey, Gabe, Zia needs 300 face shields tomorrow. And he was like, well, okay, well, I have 300 face shields in my kitchen. And I think my wife wants me to get them out of here. So we put just a really quick trip. I was like, let's do it. Let's go. Let's get them there. So we got to go up to Zia Pueblo and drop those off. That was right when the Pueblos were starting to close their boundaries off, so people couldn't enter. So Gabe was talking about these 3D printed masks, and Dr. Solis and her team at UNM. There's a picture of one there, but I have one here that I can give you a personal tour of. So this is, it's kind of a flexible resin. And you can see this is what it would look like if you were putting it on your face. It just has simple elastic bands. So this part is just 3D printed. And then inside here, this is actually furnace filter for like a home furnace. And it's capable of filtering very small particles, N95 quality or plus. So what Christina's team was doing, and then there's the cartridge here. And if you can't see, there's actually another filter, just a very thin filter on the front of it. So they would 3D print these two pieces. And then they had someone who would get these giant furnace filters that they were getting from Home Depot and stuff. And they would cut them down to size so that they could fit into the cartridge. And they had that going. It was a 24/7 operation. And they had set up a clean room where all the volunteers that were making the masks were doing so in a very safe manner to make sure everything was sanitary. And the entire workforce was pretty much, I think there were some students maybe from UNM. Otherwise, they were nurses. And these nurses, when they weren't at work, dealing with COVID patients, they were at the little workshop making these. And they were making these in insane numbers, by the thousands. And so Christina and her team, she was teamed up with a flight nurse named Laura Schaefer. And they would actually sometimes use the airplane that Laura was flying on as a nurse to make deliveries, which was really cool. Laura would fly around the state to pick up a patient and simultaneously, drop off a box of masks and some water and supplies to the medical team at the clinic she flew into. So they were just a really great group of people to work with. Protect New Mexico, the students were very, very thoughtful in how they were approaching their work, and very ambitious. And I know Gabe worked really closely with them, helping them coordinate their efforts. One of the things that I really, one of my favorite moments was, if you remember, it might have been June, the governor locked down Gallup. She used the riot, what's it called? The Riot Control Act to essentially lock people out of Gallup and prevent people from leaving. And she used the National Guard and the state police to close off the exits on I-40 and stuff. Well, Gallup was a really hard hit area, like we know. And we were consistently supplying Rehoboth Hospital, the Indian Health Services Hospital out there. And then they had a field hospital, which we were sending a lot of supplies to. So the students had pinpointed that region as like a hot spot and a priority spot for them to deliver to. And they had a significant delivery that they wanted to make during that shutdown, and they couldn't get into Gallup. So I was able to just reach out to one of my contacts at the National Guard, let them know what was going on, that we had some supplies we wanted to get to the hospitals. And they connected me with a major at the state police department, who connected me with the state troopers that were on the exit. And I told them I have like 3 cars of medical students that need to get into Gallup to drop off medical supplies. And they gave them the go ahead. They let them in. They were able to make their delivery. So I just think that's a really good example of how we were able to pool resources. A lot of people were approaching the Senate office looking for supplies or trying to donate supplies. And the collaborative gave us a very tangible entity to send those queries to. So if they needed supplies, we would direct them to the collaborative. If people were trying to donate through the office, we'd redirect them to the collaborative. That networking capability, being able to communicate across different levels of government and different agencies to troubleshoot and increase the efficacy and impact that the collaborative had was remarkable. We had the whole congressional delegation, 3 House members and 2 senators, the governor's office, obviously the Air Force. We have national labs involved, universities, tech companies. It's just a really remarkable group of people. So
Yeah, I was adding on to that. It is something that I did not realize would happen, was definitely not planning, but because of the nature of the problem and the urgency, a lot of entities came together and worked very fast with each other to get things done that might normally not ever happen this way. One of our unsung heroes was Jennifer Sensabaugh at MEP. She knew a ton of people, especially on the manufacturing side and the supply side. And she gave us a lot of great advice, connected us to a lot of great people when we needed it. And she was a consummate player involved here to help us do that. She's kind of pictured here in the by the bus. So speaking of the bus, I think Beth has a few stories even that she was glad to be involved with.
Yeah, thanks, Gabe. I'll share a couple quick stories because I know we are coming up to our last 15 minutes here, I think, and I want to be sure we have time for some Q&A. So my role in working through HIMSS and also in conjunction with the PMI, Gabe and his team asked us and said, can you help us with the transport and delivery process? That was one of the first things we got involved with. We came in May through a collaboration that I'd been working on with HIMSS and the PMI, because I'm involved in both organizations. Myself and Wes Miller jumped in and we started working to try to figure out how to get some of this stuff around the state. So in the picture of the bus, that was actually one of the first deliveries that I helped with, where we had a large supply of gowns. You'll see a picture over to the left of a lot of boxes. We had a lot of gowns and some other supplies that needed to go up to the San Juan Regional Medical Center. So the team met up and we loaded up a bus that was basically part of the New Mexico DOT, which we partnered with for this delivery. They had an arrangement through the CARES Act to be able to transport COVID patients and supplies and things. So that large coach was what showed up, and we loaded it up and sent it up to San Juan. So that was another one of our partnering entities that we used for that large delivery. So we worked basically to try to figure out how to get donations down to the rainforest where they were stored, have people pick them up. And then we delivered them in a lot of different ways. People drove them around in cars. We had things shipped up from New Mexico Tech with hand sanitizer. And one of the things we were doing later in the summer is we were doing some airlifts with the help of Protect New Mexico. Down in the right-hand corner, you'll see a photo of a plane with a nun carrying some hand sanitizer. That is a group that I spent a lot of time talking to called Little Sisters of the Poor in Gallup. And they, as we were talking about before, those areas of New Mexico were hit particularly hard. So we needed to get some things out there quickly to them. And that's a photo of one of the drop-offs to that organization. Little Sisters of the Poor is a nonprofit. They do a lot of different things, but they also had some long-term care there, and they were getting hit really hard by COVID. So that was one of the groups that I think was especially close to my heart when I was talking to them. We also did some work, a lot of work with other areas in the Navajo. There's a photo kind of up to the left with a Dion's bag. They got very excited when I dropped that off that day because they thought I was bringing them Dion's. But what I brought them was hand sanitizer and some gowns. This was to a small outlier community that's just to the west of here called Canyoncito. They're part of the Navajo Nation, but they're kind of separate. And they had really been looking for some supplies. They have a small healthcare center there. So they were really in need of some things. And so I dropped it off that day, and that's a photo from that. So those are a couple of the stories from my work. It's been a great experience for me personally to be involved in this. And I learned a lot about the state, about the community, doing this as well. So I thank Gabe and the collaborative for letting me participate.
Yeah, thanks, Beth. So I know we kind of went a little long here. I think we were going to leave some time for questions. We could go on and on with the multiple stories. There were so many. Everybody in this collaborative, in my mind, was a hero. Everybody who touched this work made a huge contribution. But I guess we could leave it open to questions, or I guess,
Yeah,
Beth, are you moderating?
Yeah, I'm going to do the questions. So there's a question from Amanda. Are you prepped for this next surge?
Right. So there's a nuance to my answer. In a sense, we are, because we've been doing this a while now, so we at least know what to expect. I think people probably know, maybe in a certain sense, who to go to if they have needs, if they have we are still getting donations, it turns out. Because of all of the work we did previously, some of the more frequent interactions that we had been doing, I have curtailed that a little bit, because a lot of our, everybody here is volunteering, really, is what it amounts to. They've been volunteering their time. So in some sense, a lot of us are getting back into the normal flow of our day-to-day lives. So I have kind of backed off our immediate, more frequent meetings, but we are continuing to run the operation. And partly it's because I'm trying to keep tabs on how things might progress. We're seeing this bigger spike. So I'm trying to keep our ear to the ground as to what is happening, what might be needed. Right now, not anything specific has been brought our way, but we're ready to roll if it does.
Thanks, Gabe. From Margaret, on logistics, any unmet requirements there? What about partnerships with Uber or Lyft or something else?
Say that again. I'm sorry.
Margaret Hall has a question on logistics. She says, are there any unmet requirements Have you considered partnerships with Uber or Lyft or something else?
No, that's a good point. We had not, I had not ever really considered that too much. We did loosely talk about it, but I think Beth probably knows more than I do. We talked about alternate ways to get things transported. I just have never, I don't think any of our members have ever necessarily reached out to make that connection. It's a great idea. Maybe we should. Anybody want to volunteer to help us? Reach out. Always recruiting for the collaborative too, if you want to join.
Let's see, Amanda, for Lily, can you see, this may be a question for Lily. Can you see how this collaborative can provide information to support your work from the town halls?
Absolutely. And I want to just first, I mentioned it in the comments, but I just want to thank you all for presenting and for the incredible work that you've done and for showing that equity isn't just a way we describe our work, but it's really action oriented and it's highly relational. So there were a myriad of recommendations. We in the town hall, we worked with communities across New Mexico pre-town hall to help frame up priorities and issues around toxic stress, trauma, and resilience, questions around workforce and their cultural and linguistic assets, discussions around the continuum of care and how, not every community has a promotion, prevention, intervention, and treatment framework, and folks are piecing together systems of care, often at great travel expense. And we also talked about food systems. So we covered quite a range of issues that New Mexicans thought were most vital to our health and well-being, all with that insight also around equity. But one of the areas that I think is very closely in line with the good work that you all are doing is around trying to figure out better ways of using technology to connect places where there's excess food to places that are experiencing food apartheid. And so so I'm listening to you all and I'm thinking about the way that you set up information sharing systems to coordinate in a broad way. And I'm thinking, oh, wow, that's so aligned with the recommendations around what we might be doing around food distribution as well to make that more systematic. And so, I'm inspired by what you all are doing and see some real parallels.
Yeah, thanks, Celie. You might need, if you haven't, and dare I say this, but you might should have a good conversation with Amanda.
We've had some and there's more to come. Amanda,
Okay.
everyone had things to talk about, but thank you.
Always here, glad to help, guys.
Are there any other questions? I'm looking in the chat. I think I know there's been a couple comments here.
Tom says something there.
Oh, hold on. Go down. Tom, can any of the, this is from Tom East. Tom, thanks for being here today. Can any of the data support the work you're doing at Synchronous? Could we connect PPE and food distribution?
This is Tom East. I think that was a question for me. I think that the health information exchange would be happy to help in any way we can. We can help with sharing information about availability of PPE and what people's needs are from your organization. We can have a link or a connection if folks would be interested in that. And so we'd be happy to help in any way we can.
Okay, yeah, that's really cool. So let's talk. Let's figure out what maybe the good connection point is and go from there.
Sure.
Gabe, I would just say that food and PPE we've discovered are great companions, and some of the partners in the collaborative really focused on bringing food to the table, so to speak, with PPE deliveries. And oftentimes when we were delivering to the Navajo Nation, we were delivering bulk food items, like hundreds of pounds of beans, rice, flour, things like that. One of the most recent deliveries we've done through the collaborative was to the Alamo chapter of the Navajo Nation, which is very disconnected from Navajo proper. It's down by Magdalena. And we partnered with a group called Food is Free Albuquerque. And they brought in live fruits and vegetable plants, fruit trees, things like that. They actually brought in soil as well as fruits and vegetables. So they're definitely partner supplies.
Okay, so thanks everybody. There's just a quick message. We're coming up on the hour. There is a question from Matt, but a lot of you may be interested. There's a question about getting a copy of the recording and the slides, and we have talked about that, and we'll let you know when those are available. I believe they're going to go on our HIMSS website. So Amanda, I want to hand this back to you now to close the meeting, if that's okay.
Totally great. And thank you so much, everyone, for joining us today. We are so excited about this work because we see a kernel of support starting from just one little area and then see how it expanded. And that's what Gabe's whole purpose in life seems to be, is getting things started and then accelerating them into great possibility. So I just want to thank all of our guests today. I want to thank the attendees and volunteers that supported this effort. Everyone has been so gracious. Every time I know I reached out, they were like, sure, what can we do? How can we help? So thank you to our community, and looking forward to connecting more COVID19.org support with Lily and maybe Tom's group from Synchronous, and also what they're doing at PHS. Check out our LinkedIn for New Mexico HIMSS chapter. We've highlighted great work that these organizations are doing this week. We will post this video, as Beth mentioned, and we hope to see everyone at our next HIMSS event. Thank you all.